Welcome to Beyond the Needle, a physician's guide to increasing COVID-19 vaccination rates. Brought to you from the Illinois Academy of Family Physicians through the Illinois Vaccinates or IVAC grant. I am Carl Lambert, family physician and a member of IAFP, and I'm an assistant professor of family medicine at Rush University Medical College. IVAC is a joint effort administered by the Illinois chapter of American Academy of Pediatrics, ICAAP, the Extension for Community Health Outcomes, ECHO Chicago, and the Illinois Academy of Family Physicians, the IAFP. Funding for this podcast series was provided by the Office of Disease Control through the Illinois Department of Public Health. The goal of IVAC is to ensure Illinoisans are being immunized against COVID-19 at every opportunity, and that providers are prepared to immunize all eligible age groups. Support for providers is available through boot camps, learning collaboratives, do-it-yourself toolkits, and this podcast series. For more information, visit IllinoisVaccinates.com. CME credit is available for each podcast through the Illinois Academy of Family Physicians. The IAFP is accredited by the Accreditation Council of Continuing Medical Education, the ACCME, to provide continuing medical education for physicians. Information on how to receive credit can be found on the Illinois Vaccinate website under podcasts. Through this podcast series, we will empower the primary care physician to feel confident in implementing COVID-19 vaccination so that their patients can receive the vaccine at a routine visit. You will hear from a variety of primary care clinicians and staff from across the state who've become experts on COVID-19 vaccine implementation. As primary care clinicians, this is the kind of work we've been doing throughout our careers. For centuries, we've been trusted allies in preventive health for individuals, families, and communities. We will share the highs and the lows of our experiences and lessons learned throughout the pandemic. Thank you for joining us as we come together to vaccinate against COVID-19. Today, Drs. Alavi and Sassetti introduce this podcast series and explain, in their own words, the goals and what this series hopes to achieve. Dr. Mustafa Alavi is a family physician at a federally qualified health center, also known as FQHC, Erie Family Health Centers, and co-site medical director. He also serves on the board of directors for IAFP. Dr. Marian Sassetti is a partner at Lake Steet Family Practice in Oak Park with over 30 years of experience. The Illinois Academy of Family Physicians recently selected her as the 2021 Family Physician of the Year. She was recognized for her community involvement and the embodiment of the words family physician, as well as a voice for those who need help beyond her practice. Additionally, she is an IAFP Fellow, Assistant Professor, and has served on the IAFP Board of Directors. We are honored to have these doctors join us today to present Beyond the Needle, a physician's guide to increasing COVID-19 vaccination rates.
Hello, everyone. My name is Mustafa Alavi, a family physician at a federally qualified health center at Erie Family Health Centers. And I'm also the co-site medical director at our Evanston clinic. I graduated from residency in 2019 and am in my first job post-residency. I'm really honored that I practice full spectrum family medicine. I attend a very busy labor and delivery service and also adult inpatient teaching service. I have a robust young panel. I take care of a lot of prenatal patients and their kids and just find it really valuable and fulfilling. I'm honored to be here along with my co-host, Dr. Marian Sassetti.
Hi, Mustafa, and hello, everyone. I'm a family physician in Oak Park. I'm a fellow in the American Academy of Family Physicians, and I'm also an assistant professor at Rush Medical School. I work out of Lake Steet Family Physicians, which is our private independent practice, for over 20-some years. I have 4 partners, 1 employed physician, 3 PAs, and I'm so honored that I have a very eclectic practice that spans a wide area. We take care of public and private payers and uninsured as well. And you know, Mustafa, I think you and I represent 2 ends of the spectrum. I've been in practice for over 30 years, and I'm a grandmother of 3, and you have a newborn, and you're just in practice for 2.5 years. But no matter what our experience, you and I both through this COVID have seen so much trauma. There's been a lot of highs and a lot of lows. And I know that over this podcast, we're going to be sharing some of them.
Yeah, it's really fun to co-host with you and to hear from your experiences. And I have a lot to learn from you. So for everyone listening, thank you for listening. And we're really excited to introduce to you the first of many podcasts developed by the Illinois Vaccinates Against COVID-19 campaign, or so-called IVAC. IVAC was developed to support all COVID-19 vaccination efforts in Illinois. And if you're interested in learning more about the campaign, please visit illinoisvaccinates.com to learn more. In this podcast series, our hope is that we can support the primary care clinician to feel confident in implementing COVID-19 vaccination so that patients can get vaccinated within their usual site of care. But before we talk about this project, let's first just take a step back and honor the struggles and trauma that got us to this point.
Yes, thanks, Mustafa. I really do think it's so important that we do honor our shared struggles and traumas that got us to this point. You know, it's been over 2 years since this pandemic first shook the globe. On March 13th, 2020, the United States declared a nationwide emergency, and our shared journey began. At the risk of sounding melodramatic, for me, there are 2 words that really typify what I was experiencing during those early months, and that was terror and trauma. I had a constant state of fear about what I might be bringing back to my home where I have a high-risk family member and what my 91-year-old community living mother might experience. And there were some real fears and traumas that went into the day-to-day, minute-to-minute practice where I had to weigh my desire to continue to be a family physician in our community and risk the unknown with people I loved most in my home. There was also tremendous trauma at watching our young, very diverse staff suffer and grieve their own family members' losses, illnesses, and losses in their communities. We did know that we had to keep their salaries going because so many of their family members and loved ones had lost jobs. They were living together and sharing apartments. So we committed to that. In addition to that, we bore witness to just enormous amounts of suffering and grief in our patients' lives. We take care of a lot of families on the West Side, and it was just routine that we'd open a televisit and there'd be somebody in tears telling us about a family member that they had lost. And one patient that I will not forget for the rest of my career was my beloved patient who opened up the computer and there she was, and she had told me that she had lost 4 family members from her nuclear family. Get choked up thinking about it, but we were both in tears, and there was very little to say other than we were going to get her through this. I also remember worrying about our colleagues and dear friends of mine who were staffing emergency rooms and ICUs, the young family members of mine who were doctors and nurses or working in the medical field who would put their families and children to bed and then call me late at night, weeping, fearful, and worried constantly, having to decide whether they were going to show up at work or not tomorrow, and just reminding them that this was something that we could all get through, but really not being very sure myself. And then finally, a horrific event in our practice where one bright, lovely young staff member of ours had to return home because her mother was horrifically, savagely, violently beaten in an Asian hate crime. So all of that, I think, is still very fresh for many of us. And I think we're going to be processing a lot of that trauma for a long time. And while I can't speak for our colleagues, I'm guessing many of us, if not most of us, saw much of what I just described.
Oh my God, that's horrible. And thank you for sharing, Dr. Sassetti. That sounds so traumatic. And I also remember just how fearful and how traumatic that time was before we had vaccinations, and just the fear of the unknown and all the trauma and everything going on in the world around us. I know when the lockdown first happened, I remember getting so many just last second urgent text messages that suddenly our clinics were being canceled. We can't see our patients. What are we going to do the next day? Can we even go outside? Can we be around anyone? We had no infrastructure whatsoever, and we have to take care of our patients. We take care of a very underserved, undocumented, uninsured, or Medicaid patients that really need support and they need medical care. And I remember we all just showed up to a building and just made cold phone calls to try to do the best care we could with no telehealth infrastructure at that point. And we were just confused, but we were doing the best we can. We had no COVID swabs. We had no supplies. We didn't even know how to send a COVID test, but we got through it. We leaned on each other. We had a deep sense of purpose that we had to come together as a clinic, our staff had to take care of our patients. In the end, we had to make the best public health recommendations and do the best we can with the limited information we had.
Yes, indeed. And what I know is we really got through it by leaning on each other. In the beginning, it was often hour by hour that we were holding each other up and buoying each other and helping our staff. When someone was down, someone else was up and comforting each other. We had my brother, who's a psychologist, come in to help our staff, again, young and so full of fear about their own losses and what they were seeing in our practice. And he would minister to them and just listen to their sorrows and griefs. And then we had Friday afternoon timeouts where we would just gather together, socially distanced in our waiting room, and process together the week, what was going on. And there was lots and lots of tears, lots of fears, but we had the constant reassurance that we were going to get through it together. One of the more interesting, fun parts was when each of us would just declare to each other, I cannot take this anymore. And I remember saying, I cannot read another article about COVID. I cannot catch up another update. Can someone please spot me? And we kind of did this back and forth where we would take a COVID literature break for 2 or 3 days and we'd pass around, did you know, or here's what the latest was. And that was very uplifting for me to lead on my partners that way. And we did very much have a sense of shared mission, just like you're describing. We understood that each one of us was playing a very necessary and important role in keeping our patients as well as each other safe and stable.
Exactly. We got through it together. And I know now being called a healthcare hero now may cause some feelings of resentment, but back then I was really thriving in all the benefits that being a healthcare hero had. I'm going to joke about this, but I thought it was great back then. I still wear my discounted North Face jacket. Great. I got discounted Allbirds shoes. I got multiple free meals. I thought I really felt supported by the community and thought, but back then I didn't know how long COVID was going to last for. And many local agencies really came together, catered meals for our clinic, for my hospital, and it really did feel like the community was coming together to help support us when we were really struggling to support the community.
Indeed. And you deserved every one of those perks. Well, we still are valued no matter what's going on and the negativity that's brewing up. And that will never change. I think, Mustafa, it's important for us to remind our colleagues across the state that we do understand how disheartening this shift is from being hailed as heroes to sometimes being called the enemies. Sadly, you and I are both aware that many of our colleagues have retired during this time because of that or because of pressures, because of COVID. And I think one of our most important messages needs to be that we are here to support you. We are here for you. And I just want to personally add that people's negativity cannot write the narrative of your career. You are very much needed and respected and appreciated. So rest up, get rejuvenated and stay in the fight. You know, a friend of mine who runs a spirituality center has said that she thinks we were born for this moment. You know, we primary care docs, these are our skill sets that our communities have used for centuries to rely on us and our credibility. We've been trusted and valued allies in promoting health and well-being throughout many, many centuries.
It was not until December 11th, 2020 that the FDA approved the first COVID-19 vaccine under emergency use authorization, which when you think about it, it's rather remarkable that the FDA was able to approve this vaccine and a novel mRNA vaccine in such short time. But we needed it and we were all eager to get it. And at the time, even though we were practicing on the front lines for so long, unvaccinated, in a state of fear and panic, once we knew that there was a vaccine available, we were all just in a rush to get it. I remember I was manically refreshing our hospital portal account, waiting for my ticket to get this vaccine that I knew I was going to get very soon, but I didn't know when. And I remember hearing from my colleagues that some would get the ticket and some didn't. And I just remember feeling guilty about the resentment we were beginning to feel that one person was getting a ticket 4 hours sooner than another person. And when is the hospital going to release their tickets for us? And we all deserve it. And we knew we all deserved it. We're all on the front line. We're all being exposed to COVID. And man, that was just really stressful. And I'm just so glad we're past that.
Indeed. We were very fortunate because we were actually vaccinated through Elmhurst because of that kind of crazy calculus that was done of vaccine patient to provider ratio. So because we were on staff at Elmhurst, we were actually vaccinated. I got a vaccine in mid-December, which was remarkable. And all I could tell you is that giant knot in my stomach finally loosened. And I remember just feeling like I could skip and say, I am not going to get my family sick. I am not going to get my mother sick. And there is a sense of elation and excitement. And one of my favorite stories, every one of my friends have heard, is that the nurse who gave me my injection suddenly had this horrified look in her face. And I looked up and she said, "Oh my God, doctor, I think I hit your bone." I said, I don't think so. But all I felt was my arm could fall off. And all I would say is, "Thank you, thank you, thank you." And that truly was the truth. I had this enormous sense of whatever else is going to happen, I'm not going to bring COVID home to someone I love. And then after that, in our practice, all of our partners got vaccinated. And we all had this very renewed sense of being energized and recharged because we were vaccinated, and we had this passion and interest to get back to our practice and make sure that we could vaccinate our patients. And there was real beauty in that. There was unanimity. There wasn't a second of difference. We all felt it and felt this passion to do it and get back and get the office up and running. And then we started the work of getting the COVID clinic and prioritizing which patients got the vaccine and when, how to get them in and out safely.
And I remember during this time, each county had different allotments of the vaccine from the state, which inherently just caused so much, I want to say chaos, because people were traveling far and wide to get the vaccine that really wanted it, along with different disparities in who was getting vaccinated, which patient populations were getting more vaccines than others compared to which communities were being exposed and suffering from COVID illness compared to others. And it was just really tough to get the vaccines to the people who needed it the most. And we were just fielding phone call after phone call for patients just eager to get vaccinated and wondering when is the clinic going to be able to vaccinate them. So I'm so glad we're able to vaccinate all of our patients now.
Indeed, it's a huge relief. We, again, were extremely fortunate because we ended up working directly with the Oak Park Department of Public Health, and they were very, very happy to partner with a community practice like ours. So from the beginning, it's been them servicing us, and we have gotten the vaccines pretty much as often and as much as we've needed them. In the beginning, of course, we didn't, and there was the allotment of our very sickest. But to this day, we are getting vaccines several times a week to fill our need. So that was a real blessing. And we could tell our practice, each person in our practice, when it's your turn, you're going to get a vaccine here from us.
That's fantastic. And some of my most uplifting moments over this past pandemic really has been the times where me as a physician, like I was able to vaccinate so many people. And that's not a role we actually do often as physicians. Like I had to train up or remind myself how to administer a vaccine. And I was able to vaccinate some of my closest friends and family members who were able to come to the clinic when it was their turn to get vaccinated. And it was just such a rewarding experience. And I was so grateful to do that. Right. And now we can vaccinate anyone age 5 and older, and down the pipeline, we're going to start hearing about getting our patients 6 months and older vaccinated. And I mean, that means my own son, who is going to be 6 months very soon, is going to be able to get a COVID vaccine. So I'm just really excited for what the future has to bring.
Indeed. And that means all my grandbabies, all 3 of them will get it. So that's our last holdout. You're right. So now our work together with IVAC is to help our colleagues across Illinois get all of our Illinois citizens vaccinated. And as we've counseled patients in our practice and your practice, we've come across so many myths and so much misinformation and hesitancy. But I am really happy to say, in all honesty, that most of our patients have agreed to get vaccinated. And that is really, really gratifying. Unfortunately, now you, me, all of us are dealing with another set of frustrations and sorrows, and that's dealing with vaccine refusal. First was the sadness and frustration and anxiety about not having enough vaccines, and now we have enough vaccines, but not enough vaccine takers. And I talk about the new suffering, which is the needless suffering, and that's the needless illnesses and deaths, the needless overwhelming of our intensive care units. And I think a lot about our colleagues who are caring for people who shouldn't be there, didn't need to be there because they did not get themselves vaccinated. And that's our next burden. That's our next challenge, is to move into that space and help our colleagues confront vaccine refusal.
And we know that some of the most important research about combating this pandemic isn't about antibodies, spike proteins, but really the power you as a primary care physician can do to help your patient get vaccinated. We are the key to increasing COVID-19 vaccination rates in our community. A recent JAMA study just from this month, a few weeks ago, February 2022, showed that the number of primary care physicians per capita was independently associated with higher COVID-19 vaccination rates. We know patients come to their physician as a trusted source and have so many different ideas or things they're hearing, and they want to talk to their physician who is a reputable source to help them sift through all the information they may be reading or hearing about on social media. And I myself, even though sometimes it feels like I'm not able to make as much of an impact with every single patient, the times I am able to help a patient get vaccinated is just so rewarding. And each and every additional patient is just an extra win to help end this pandemic.
Exactly. And I think we all knew this in our bones before these studies were published. We are the single greatest weapon in fighting this pandemic. So we want all of you, our listeners, to come out of this podcast series empowered to get your patients vaccinated, whether it's on your site or somewhere else in your community. And we know there's a wide range of clinical settings in which we all practice across the state and from which many of our own IVAC team members are practicing. So we want you to understand, each and every one of you, that you can move your patients to accepting and getting vaccines, no matter where you practice or how you practice. We're committed to sharing our experiences, our highs, our lows, our tips on what we've learned. And we're thrilled to let you know that IVAC has pulled together resources from academia, from the national guidelines, and our own experiences to help you. I want to remind us all, as primary care docs, this is our work. In fact, I personally think this is our moment and the kind of work we're already good at. We've been trusted allies in preventive health for individuals, families, and communities for centuries. We can harness our credibility and teach others how to do the same.
And in Illinois, our current vaccination rate is 67.3% as of February 23rd, 2022. And we want to get that as close to 100% as possible. And Dr. Sassetti, I have to say, I'm just so inspired by listening to you and your experiences and how you help get COVID vaccines to your community at your private practice. I know you're a family physician in Oak Park, and you were able to successfully overcome the hurdles of getting COVID vaccines within your practice, which it isn't easy. There are a lot of hurdles and barriers to get this new vaccine. Can you share with us what that process and experience was like to be a clinic in the pandemic to start vaccinating? Who did your practice turn for guidance?
Well, I do sincerely mean we were energized. We had this sense of great gratitude, and we have this wonderful practice, a lot of longevity in our practice. We decided not to furlough our staff. And by the way, we were able to take care of the PPP loan. So that gave us a lot of staff and when our patient numbers were low. So there was a lot of manpower around. And we just decided we were going to do it. And we happen to have, I personally think, the world's best office manager, Nancy, and the world's best senior physician assistant, Candy. And I'm delighted that they will both be on a podcast in a little while. But we knew we had some leadership within the clinic that we could do this. So we partners talked and involved Nancy, who often takes on the managerial aspects of doing things. And we just committed to doing it. And she interfaced, for the most part, really did most of the work interfacing with the Department of Public Health on the logistics of getting the vaccine. That was the hardest part. Up front, it was hard to get the IVAC certification to get to be viewed as a practice that could do this. So once we got that, it became a matter of using our manpower that was in excess at that point and coming up with a clinic. We had to figure out just the strategy of getting them in a door and out a door safely, socially distanced, how much time we needed to put them in a waiting room and wait for an untoward event, that kind of thing. I will say that there were challenges, but one of the most beautiful aspects of it was that our young staff really took agency and had agency around this. They were vaccinating their friends from their communities, their loved ones. And I can't speak for them, but I know that there was a real sense of participating in history, that they knew quite literally that they were saving lives. And I think that's no small matter. And I hope that stays with them for the rest of their long careers. One of, I think, the more beautiful stories that we all share is the story of one of my patients in her 80s, part of our practice for over 20 years, who got a call to come in, one of our first patients, because we did over 80 first. And our young staff member who gave her the vaccine, she just wept and wept. And my staff member sat next to her, and they both shared that beautiful moment of her being grateful. And then, of course, sent around a message to the rest of our staff about what a beautiful moment that was. I know that will stay with her for the rest of her career. And then longer, when we finally started vaccinating children 5 and over, most recently, a mother of 2 children just broke down in front of one of my young staff who also had children and just said, I think I can breathe again, quite beautifully. So I'm happy to say we no longer have the designated COVID clinics. We are now back fully into a hybrid practice. So we have televisits and patients in our office. And now it's wonderful to say that it's almost de rigueur. We have integrated the COVID vaccine into our routine day-to-day vaccination. Literally yesterday, I gave a patient a DPT and a COVID booster. I mean, it's become that commonplace or that routine now. We treat it just like any other vaccine. It's interesting and fun to tell a patient who will say something, they would ask about a shingles vaccine. I heard I'm going to have side effects tomorrow. Maybe I'll come back next week. They're saying the same thing about the booster. Maybe I'll come back next week, doc. I'll make a nurse visit and get my booster. So imagine that. Think how far we've come, that it's just a routine. Sure, I'll just come back and get my booster next week. It's fully integrated into our practice life and our patients' view of what our practice is doing for them. They can come back for a nurse visit, get their flu shot. They can come back and get their COVID booster. I'm just delighted that we're at this point in our practice.
That's so fantastic. I know at my clinic specifically, it was a big lift to get vaccines off the ground. And there was a lot of paperwork and a lot of documenting that we had to kind of suss out who would be doing. And I was just grateful that we leveraged a lot of our non-physician support staff to really take this on and lead it and get vaccines up and running. So we use everyone's to the top of their license, and we were able to develop a vaccine clinic within our own clinic as well. And we also partnered with community agencies and our hospital partner affiliates, and we're able to do big COVID vaccine fairs within the city itself, which was also, as a provider, just really gratifying and felt like I had a sense of purpose, saving lives, vaccinating patients in these zip codes that were really hard hit by COVID-19 that needed vaccines. We saw people waiting in long lines to get these vaccines, and it was just great to be part of the team to vaccinate that community. And I know part of the issue why we're still vaccinating as a separate vaccine clinic is that the entire nation is being gripped by this huge healthcare shortage, and we're doing the best we can with limited healthcare workforce. So, Dr. Sassetti, what are some of the struggles that you or your practice partners are seeing with COVID vaccines?
Well, we're pretty fortunate. I think the big struggles are over the big hills and getting the vaccine in, all the paperwork. We're past that. Now that we're up and running again in a full hybrid, we do have some manpower issues, but not as bad as some other areas. I'll tell you, I think one of the greater struggles is the philosophic one that weighs on us and saps energy. And that's, knowing that there's a vaccine that can keep individuals and communities safe, and having to live in a world where some of our patients don't share that understanding, and they may be putting our high-risk patients, our own loved ones, at risk. So we constantly are dealing with that. The other struggle is, I call it silo living. We don't see a whole lot of each other. We actually do Zooms to do staff meetings. Isn't that wild? Because of social distancing. So, I'm a community Italian type. I like seeing my partners. I love my partners. And we kind of are in our silos, and our new young providers, they're just starting their careers, and they're starting their careers in the middle of a pandemic, in the middle of trauma. So we're pretty aware that, those moments of beauty and wonderful moments you have starting up where you're assured that this is the right thing to do and I chose the right field and it's so rewarding, I'm very aware of that, and hoping that, we can continue to show them that they have long careers and they'll have a lot of beauty and brightness ahead. And this too will end sometime. And then now that we're back as a hybrid, and again, I alluded to that we are having manpower issues. We, in the beginning, just had our RNs giving the COVID vaccine because it was new. We were concerned about it. We hadn't done it before, and they're highly educated, very intelligent young women. But the manpower issue made it clear that we had to get our MAs to participate in that. And that was something beautiful. We watched our RNs shepherd and educate our MAs, who now are empowered and quite good at this. And again, the same MA who gave the DPT to my patient in one arm gave the COVID vaccine in the other. And that's been very, very gratifying to watch.
Wow, that's really impressive, Dr. Sassetti. And I'm really inspired hearing what it looks like for a successful practice to introduce COVID vaccines. I can't wait for my own clinic for us to move from a separate COVID vaccine clinic and integrating it within our own staff. And you've inspired me to really help get that off the ground at my own clinic.
Well, I hope we make every clinic in Illinois successful in implementing this. Vaccinating within our own clinical encounters gives us opportunities to discuss patient concerns, and it limits those big barriers of the patients going elsewhere for a vaccine. I do want to acknowledge, however, that there's still several barriers to doing this within many of our colleagues' practices. So over the course of the next few podcasts, we hope to tackle those barriers and give helpful hints and solutions to any clinicians hoping to vaccinate with their own practice.
Well, Dr. Sassetti, this was really fun getting to take a trip down memory lane of where we've been and where we are now. I mean, I know I said it a bunch already, but I'm just super inspired just by hearing your experiences and reflecting on how much strength we have as a community, and just to remember how much has changed over the last few years. I'm really excited to continue these conversations on future podcasts.
Me too. It's been delightful to get to know you, Mustafa. And I think together we hold a vision for all of our colleagues to let them know there is support to lean on and resources to turn to. I especially appreciate this opportunity to thank you all, our colleagues across Illinois, for all the work you've already done and for all the work ahead of you as we face this together as a community of healers helping each other.
As you are tuning into this podcast series, if you have any questions, comments, or topics you'd like us to address over this series, please go to the IllinoisVaccinate.com website and leave us a comment. Marian, thank you so much for this wonderful conversation. This was great, and it really was such a pleasure to make this podcast with you. Once again, my name is Mustafa Alavi, a family physician. Our next few podcasts over the course of this series will be exploring in greater detail some of the barriers and issues with becoming a COVID vaccinator. And also we'll be talking about skills with motivational interviewing and how to manage vaccine hesitancy, which is just so prevalent in our community right now, amongst many other future topics. If you found this helpful, please share this with your colleagues. We want everyone to be comfortable vaccinating within their own clinics. If you have any questions, comments, or topics you'd like us to address in the future, please also email us at podcast@illinoisvaccinates.com.
Thank you to our expert faculty and to you, our listener, for tuning into this episode. If you have any comments, questions, or ideas for future topics, please contact us directly at podcast@ilvaccinates.com. For more episodes of Beyond the Needle, please visit illinoisvaccinates.com/podcasts. You'll find links to resources, transcripts, speaker disclosures, a survey to gather your feedback, and instructions to claim CME credit. Subscribe to this podcast series on Healthcare Now Radio, Spotify, Apple, Google Play, or any of the major podcast platforms. Please follow the Illinois Vaccinate Project on Facebook, Twitter, Instagram, and LinkedIn. Thank you again, and we hope you tune into our next episode.